Hey everyone, welcome to our explainer on the foundations of clinical terminology. Today, we're going to build your English vocabulary so you can better understand and talk about addiction. Now, medical English? Yeah, it can seem pretty intimidating at first, especially when we're discussing a highly sensitive topic like substance use. But please don't worry, we are going to break it down step by step together. Whether you're a student learning English for your future career, a medical professional, or just someone looking to support a loved one, the specific English words we choose have absolutely incredible power. So let's dive right in and look at how we define and discuss this complex topic with dignity, accuracy, and clear communication. Here is our roadmap for today. 1. Words matter. 2. The 4 C's of addiction. 3. The medical model. 4. The cycle of addiction. And 5. Knowledge check. We're going to move progressively from how we socially talk about addiction to how it actually manifests behaviorally, and finally, how it operates biologically. And we'll wrap the whole shebang up with a quick practice activity to lock in those new vocabulary words. All right, let's jump right into section 1, Words Matter, Clinical Terminology. Take a look at this shift. Notice how we're moving away from the stigmatizing language on the left to person-first clinical terms on the right. Think about the English grammar here for a second. When we use words like addict, alcoholic, or junkie, we're literally using a noun to define a person's entire identity. And honestly, those words carry a massive social stigma. They mark the issue as shameful, which, often makes people want to hide their struggles rather than seek help. But in modern clinical settings, we change our grammar. We use terms like substance use disorder or substance dependence. By saying a person with a substance use disorder, we're using a prepositional phrase. This grammatical shift is absolutely crucial because it shows that this is a condition they have, not who they are. It completely separates the human being from the disease. It's a subtle vocabulary shift, sure, but it provides the dignity and understanding required for recovery. Let's anchor our learning with this formal definition, highlighting that substance use disorder is a diagnosable medical condition rather than some sort of moral failing. According to the DSM-5, this is a primary chronic disease. Now, chronic is a super important medical English term here. It means the condition is long-lasting and persistent. It doesn't just go away quickly. This disease physically impacts the brain's reward, motivation, and memory circuitry. You can kind of think of circuitry exactly like the electrical wiring in a house, but, inside your head. When an individual is introduced to a substance, it triggers this huge flood of dopamine, which is basically a chemical messenger in the brain associated with pleasure. Over time, the person continues to use the substance to try and achieve that exact same reward feeling, and that actually permanently alters the brain's natural wiring and chemistry. Moving right along to section 2, the 4 C's of addiction. Before we reveal the answer, take a quick moment. Can you think of any English action words or nouns that start with the letter C? What behavioral traits might you actually see in someone with a substance use disorder? How might this disease change their daily actions and decisions? Okay, so the core symptoms of addiction involve a craving for the substance, a loss of control over use, a compulsion to keep using, and continued use despite negative consequences. Let's practice our pronunciation and unpack the nuances of these words. Go ahead and say the first word out loud with me. Craving. A craving is an incredibly strong, intense desire. Imagine someone who finds alcohol so pleasurable, they literally cannot stop thinking about going to the bar after work. That's the craving. Now say the second word, control. Specifically, a loss of control. They try to cut down their drinking, but they repeatedly fail. Next up, say the third word, compulsion. Here is a really important English distinction for you. A craving is the feeling, but a compulsion is the unstoppable urge to actually do the action, even if you don't really want to. They might begin reorganizing their entire life just to maximize drinking opportunities, completely neglecting family and work. And finally, consequences. Even if their spouse leaves or they lose their job, they keep drinking. That is use despite consequences. Let's dive into section 3, the medical model explained. Just look at the difference here. Notice the decreased brain metabolism in a cocaine abuser compared to a healthy brain. For our English learners, the word metabolism here refers to the brain's energy and activity levels. The medical model teaches us that addiction is a chronic, relapsing brain disease, and the word disease is vital vocabulary because it completely replaces the idea of choice. Just like heart disease changes the physical heart, substance use disorder physically changes the brain. Look at the healthy brain on the left. It's bright and full of energy and activity. Now compare that to the diseased brain on the right, which shows significantly less activity. These physical, long-lasting structural changes are exactly why it is so incredibly difficult for someone to just stop using a substance without professional help and medical treatment. Now for section 4, the cycle of addiction. Let's see how this cycle actually builds through 3 progressive stages. You're going to see some complex medical terms here: the basal ganglia, the extended amygdala, and the prefrontal cortex. Now, do not worry about memorizing these difficult anatomical names right now. Instead, I want you to really focus on the English action words associated with them: binge, withdrawal, and anticipation. In stage 1, the reward center is activated. This is where the intense pleasure, or the binge, happens. In stage 2, as the drug wears off, the brain's stress center takes over. This causes the painful withdrawal stage, creating highly negative feelings, stress, and even physical sickness. Finally, in stage 3, the brain's planning and decision-making center is basically hijacked. Instead of focusing on healthy daily tasks, the brain becomes entirely preoccupied with the anticipation of getting the next dose. They plan, they seek, they use, and then the cycle just repeats itself endlessly until treatment interrupts it. All right, bringing us to section 5, knowledge check, practice activity. Let's test your English comprehension of today's material. Take a few seconds to think back to our timeline. Which specific brain region is responsible for the negative feelings, stress, and anxiety experienced during the withdrawal stage? The extended amygdala. If you guessed the extended amygdala, absolutely fantastic job. This region drives the withdrawal stage, making the individual feel physically and emotionally unwell when the substance is finally removed from their system. Let's try one more to test our new vocabulary. How do we correctly shift our language to use clinical, non-stigmatizing terminology? Remember our golden grammar rule. We want to put the person before the problem. The correct term is a person with a substance use disorder. Go ahead and say it out loud to practice. Person with a substance use disorder. This phrasing really emphasizes that this is a manageable medical condition. Using this specific grammar helps create a supportive environment rather than a judgmental one. To conclude our explainer, I want to leave you with this final thought. Really reflect on how our English words and our understanding of the brain can significantly reduce stigma and empower those seeking help. When we recognize the 4 C's as symptoms of a physical brain disease, and when we choose vocabulary that respects the individual as a human being first, we stop punishing and we start supporting. So, how will you use these new foundations of clinical terminology in your own conversations? Keep practicing your English vocabulary, keep learning, and I'll see you in the next explainer.